How did you hear about this position?
I first learned about this position through a professional colleague who works in the same field and was aware of my interest in pursuing opportunities within your esteemed institution. They spoke highly of the hospital's commitment to innovation and excellence in patient care, which immediately caught my attention. Following that, I did further research on your hospital's website and was impressed by the diverse range of specialties and the emphasis on collaborative, multidisciplinary approaches to healthcare. Additionally, I found the position listed on a reputable medical job portal, which further reinforced my interest, as it provided more detailed insights into the role and the values your institution upholds.
Why do you wish to work for this organization?
I am particularly drawn to this organization because of its outstanding reputation for providing cutting-edge healthcare services and its commitment to continuous improvement and patient-centered care. The hospital's emphasis on research and innovation aligns perfectly with my passion for staying at the forefront of medical advancements. I admire the organization's collaborative environment, where multidisciplinary teams work together to deliver comprehensive care. Additionally, the institution's dedication to professional development and education resonates with my own desire for continuous learning and growth. I am excited about the prospect of contributing to an organization that not only excels in clinical care but also prioritizes the well-being and development of its staff.
What are your goals 30 days into the role? 60 days? 90 days?
In the first 30 days of the role, my primary goal would be to acclimate to the hospital's environment, policies, and procedures. I would focus on building relationships with my colleagues, understanding the workflows, and familiarizing myself with the patient population and the specific needs of the department. Additionally, I would aim to participate in any initial training or orientation programs to ensure I am fully aligned with the organization's standards and expectations. By 60 days, I would aim to have integrated into the team more effectively, contributing to daily operations with increasing autonomy. I would seek to deepen my understanding of the department's specific challenges and begin to propose or implement strategies to improve patient care, leveraging my expertise and experience. I would also start engaging more actively in team meetings and collaborative initiatives, positioning myself as a reliable and proactive team member. At 90 days, my goal would be to have established myself as a key contributor within the department, fully competent in managing my responsibilities and delivering high-quality care. I would look to evaluate my progress, gather feedback from supervisors and peers, and identify areas for further improvement. Additionally, I would aim to start setting long-term goals aligned with the organization's objectives, such as participating in research projects, contributing to process improvements, or enhancing patient outcomes through innovative approaches.
Do you have a goal you plan on accomplishing in the next year?
Yes, within the next year, I plan to accomplish several key goals that align with both my professional growth and the organization's mission. Firstly, I aim to enhance my clinical expertise by engaging in specialized training or certifications relevant to my field, ensuring that I remain at the forefront of medical advancements. I also plan to contribute to at least one research or quality improvement project within the institution, focusing on areas that can lead to better patient outcomes or more efficient healthcare delivery. Moreover, I intend to develop strong professional relationships within the multidisciplinary team, fostering a collaborative environment that benefits patient care. Additionally, I would like to take on a mentorship role, supporting junior staff or medical students, which will help in building a supportive learning culture. Ultimately, my goal is to become a valued member of the organization, contributing meaningfully to both the day-to-day operations and the broader strategic goals of the hospital.
Why do you think the organization may benefit from hiring you?
I believe the organization would benefit from hiring me due to my comprehensive clinical experience and commitment to excellence in patient care. I bring a proven track record of effectively managing complex cases and delivering high-quality outcomes, which aligns with the hospital's standards of excellence. My ability to work collaboratively within multidisciplinary teams ensures that I can contribute to fostering a cohesive and efficient work environment, enhancing the overall patient experience. Additionally, I have a strong background in research and quality improvement initiatives, which can help the organization stay at the forefront of medical innovation and improve operational efficiencies. My dedication to continuous learning and professional development ensures that I am always up to date with the latest medical practices and technologies, allowing me to bring fresh perspectives and evidence-based approaches to the team. Overall, my skills, experience, and commitment to both patient care and professional growth position me to make meaningful contributions to the organization's success.
What do you already know about the organization? Include technical details.
I already know that this organization is highly regarded for its commitment to delivering exceptional patient care and its emphasis on innovation and research. The hospital is known for its state-of-the-art facilities and advanced medical technologies, which support a wide range of specialties and services. I am aware that the institution places a strong emphasis on a multidisciplinary approach, fostering collaboration among various departments to ensure comprehensive and holistic patient care. Additionally, the organization is dedicated to professional development and continuous learning, offering numerous opportunities for staff to enhance their skills through training, education, and involvement in research projects. The hospital's commitment to community engagement and outreach programs also reflects its dedication to improving public health beyond its immediate patient population. This focus on excellence, innovation, and community service is what makes the organization stand out and aligns closely with my professional values and aspirations.
Do you have any other questions about this role or the organization?
Yes, I do have a few questions about the role and the organization. Could you provide more details about the structure and dynamics of the team I would be joining? Specifically, I'm interested in understanding the team's composition, the typical workflow, and how new members are integrated into the team. Additionally, I'd like to learn more about the opportunities for professional development and advancement within the organization. Are there specific programs or pathways for continuing education, research involvement, or leadership development? Lastly, I'm curious about how the organization fosters a culture of innovation and collaboration. Are there regular forums or initiatives where staff can contribute ideas for improving patient care or operational processes? These insights would help me better understand how I can contribute to and grow within the organization.
Why did you choose to become a doctor as your career path?
I chose to become a doctor because of my deep desire to make a meaningful difference in people's lives through healthcare. From an early age, I was drawn to the sciences and fascinated by the complexities of the human body. However, it was the profound impact that compassionate and skilled medical care can have on individuals and communities that solidified my decision. I wanted a career that combined my passion for science with the opportunity to help others directly. Witnessing the positive outcomes that effective medical intervention can bring, whether it's alleviating pain, managing chronic conditions, or saving lives, inspired me to pursue this path. The ability to continuously learn, adapt, and apply knowledge to solve real-world health challenges was another motivating factor. Ultimately, becoming a doctor allows me to engage in lifelong learning while contributing to the well-being of my patients, which is deeply fulfilling and aligns with my core values.
What is the best medical success story of your career so far?
One of the most memorable medical success stories of my career involved a patient who presented with a complex, life-threatening condition that required immediate and multifaceted intervention. The patient, a middle-aged individual, was admitted with severe sepsis stemming from an undiagnosed abdominal infection. The situation was critical, and it required rapid assessment, coordinated care, and decisive action. I led a multidisciplinary team to stabilize the patient, which involved initiating broad-spectrum antibiotics, fluid resuscitation, and preparing for emergency surgery. Throughout the process, close communication with surgeons, intensivists, and nursing staff was crucial. The surgery revealed a perforated bowel, which was promptly treated. Postoperatively, the patient faced several complications, including organ dysfunction, but with meticulous care and gradual interventions, they made a remarkable recovery. The patient's eventual discharge and return to a normal life were incredibly rewarding. This case underscored the importance of teamwork, quick decision-making, and holistic patient management. It reinforced my commitment to providing comprehensive care and highlighted the profound impact that coordinated medical efforts can have on saving lives and restoring health.
What tools and equipment are you familiar with using on patients?
Throughout my medical career, I have become proficient in using a wide range of tools and equipment essential for patient care. I am well versed in using diagnostic tools such as stethoscopes, sphygmomanometers, otoscopes, and ophthalmoscopes for routine physical examinations. I am also skilled in interpreting results from electrocardiograms, ECGs, and imaging studies like X-rays, ultrasound, CT scans, and MRIs, often collaborating with radiologists for more complex cases. In critical care settings, I have extensive experience with ventilators, defibrillators, and patient monitors that track vital signs like heart rate, blood pressure, oxygen saturation, and respiratory rate. Additionally, I am proficient in using various surgical instruments during minor procedures, such as suturing kits, scalpels, and hemostats, and I have assisted in more complex surgical settings, gaining familiarity with advanced surgical tools and techniques. Furthermore, I have experience with point-of-care testing equipment, including glucometers and portable blood gas analyzers, which allow for rapid bedside assessments. My continuous engagement with these tools ensures that I can effectively contribute to accurate diagnosis, monitoring, and treatment, providing the highest standard of care to patients.
Why are you leaving your current position?
I've greatly valued my time at my current position and the experiences I've gained. However, I'm now seeking an opportunity that offers further professional growth and development in line with my long-term career goals. I'm particularly drawn to mention specific aspects of the new role or institution that appeal to you, e.g., research opportunities, a specific patient population, a teaching hospital environment. While I've appreciated the challenges and rewards of my current role, I believe that this new opportunity will allow me to expand my skill set and contribute to a different healthcare setting, ultimately enhancing my ability to provide excellent patient care.
How do you inform or educate patients and their families about challenging news?
When delivering challenging news to patients and their families, my priority is to create a supportive and empathetic environment. I begin by ensuring privacy and establishing a comfortable setting where we can speak openly. I then try to gauge their existing understanding of the situation before clearly and compassionately delivering the news, using simple language and avoiding medical jargon. It's crucial to allow time for the patient and family to process the information and express their emotions, whether it be shock, sadness, or anger. I actively listen to their concerns and answer their questions honestly and sensitively, providing reassurance and support. Throughout the conversation, I emphasize that they are not alone and that we will work together to develop a plan moving forward. I also ensure they have access to appropriate resources, such as counseling or support groups, to help them cope with the challenges ahead.
Have you experienced disagreement or conflict in the workplace with colleagues? How did you handle the situation?
Yes, like most professionals, I have encountered disagreements in the workplace. One instance that comes to mind involved differing opinions with a colleague regarding a patient's treatment plan. While we both had the patient's best interests at heart, we had different approaches based on our individual experiences and interpretations of the available evidence. In this situation, I first made sure to listen carefully to my colleague's perspective, trying to understand their reasoning and concerns. I then calmly and respectfully presented my own viewpoint, backing it up with relevant research and clinical guidelines. We engaged in a constructive discussion, focusing on the evidence and avoiding personal attacks. Ultimately, we agreed to consult with a senior colleague to gain an objective third opinion. This collaborative approach allowed us to reach a consensus that prioritized the patient's well-being and strengthened our professional relationship. I believe that open communication, mutual respect, and a focus on shared goals are essential for resolving workplace conflicts effectively.
What are your strategies for educating individuals about their health?
My strategies for patient education revolve around creating a collaborative and empowering experience. I believe effective health education starts with understanding the individual patient's needs, health literacy level, and learning style. I avoid using complex medical jargon and instead opt for clear, concise language, often using analogies or visual aids to explain complex medical concepts. I prioritize active listening to understand their concerns and address their specific questions directly. I also believe in tailoring the educational approach to the individual. For some patients, written materials like brochures or handouts are helpful for reinforcement at home. For others, a more interactive approach, like demonstrating a technique or using online resources, may be more effective. I always encourage patients to ask questions and create an open dialogue where they feel comfortable expressing their concerns. I emphasize preventative care and shared decision-making, empowering patients to take an active role in managing their own health and making informed choices about their treatment options. Finally, I ensure they know how to access further support and resources within the healthcare system and their community.
Can you talk about a time when you were required to collaborate with other healthcare professionals?
Certainly. A particularly memorable instance of interprofessional collaboration involved a patient presenting with complex multisystem issues. This patient required coordinated care from several different specialists, including cardiology, nephrology, endocrinology, and physiotherapy, in addition to nursing staff and social work. My role as the primary physician was to ensure seamless communication and coordination between all members of the team. This involved organizing regular interdisciplinary team meetings where we discussed the patient's progress, shared updates from our respective specialties, and collaboratively developed a comprehensive care plan. We used a shared electronic health record to ensure everyone had access to the most up-to-date information. Open communication was crucial. We utilized both formal meetings and informal discussions to address any emerging issues or concerns promptly. For instance, when the nephrologist raised concerns about the impact of a certain medication on the patient's kidney function, we immediately discussed alternative options with the cardiologist and adjusted the treatment plan accordingly. This experience underscored the importance of effective teamwork, clear communication, and mutual respect among healthcare professionals to provide holistic and patient-centered care. It highlighted how collaborative efforts can lead to much better outcomes for patients with complex medical needs.
What are your values in the workplace? How do you prioritize and implement them into your workflow?
My core values in the workplace center around patient-centered care, professionalism, continuous learning, and teamwork. Patient-centered care is paramount. I strive to treat every patient with empathy, respect, and dignity, ensuring their needs and preferences are at the forefront of every decision. I prioritize this by actively listening to their concerns, explaining medical information clearly, and involving them in shared decision-making. Professionalism, to me, means maintaining high ethical standards, demonstrating integrity, and communicating effectively with colleagues and patients. I implement this by adhering to professional guidelines, maintaining confidentiality, and fostering open and respectful communication. Continuous learning is crucial in medicine, so I actively seek opportunities to expand my knowledge and skills through conferences, workshops, and staying updated on the latest research. I dedicate specific time for this within my schedule, ensuring I remain at the cutting edge of medical advancements. Finally, teamwork is essential in a healthcare setting. I believe in fostering a collaborative and supportive environment where every team member feels valued and respected. I prioritize this by actively participating in team meetings, sharing knowledge, and offering support to colleagues. I implement these values by consciously reflecting on my actions and interactions, seeking feedback from colleagues, and consistently striving to improve my practice. I believe these values are not just abstract concepts, but rather guiding principles that shape my daily workflow and contribute to a positive and effective healthcare environment.
What do you enjoy most about being a doctor? What do you like least about your role?
One of the most rewarding aspects of being a doctor is the profound impact I can have on individuals' lives. Witnessing a patient's recovery, whether it's managing a chronic condition or seeing them through a critical illness, is incredibly fulfilling. I find immense satisfaction in building relationships with patients, earning their trust, and providing them with the support and guidance they need to navigate their health challenges. The intellectual stimulation of diagnosing complex cases and continuously learning new medical advancements also keeps me engaged and motivated. However, there are also challenging aspects to the role. Dealing with the emotional toll of witnessing human suffering and loss can be difficult. Balancing the demands of providing high-quality care with administrative burdens and time constraints can sometimes be stressful. Additionally, navigating the complexities of the healthcare system and ensuring equitable access to care for all patients can be frustrating. Despite these challenges, the positive impact I can have on my patients' lives and the intellectual fulfillment of the profession far outweigh the difficulties, reinforcing my commitment to providing compassionate and effective medical care.
How do you establish and build trust with your patients?
Establishing and building trust with patients is fundamental to providing effective healthcare. I believe it starts with creating a safe and welcoming environment where patients feel comfortable sharing their concerns. I prioritize active listening, giving patients my undivided attention, and truly hearing what they have to say, both verbally and non-verbally. I avoid interrupting and use verbal cues to show that I am engaged in the conversation. Honest and transparent communication is crucial. I explain medical information in clear, simple language, avoiding jargon, and ensure patients understand their condition, treatment options, and potential risks and benefits. I encourage them to ask questions and address their concerns openly and honestly. Empathy plays a vital role in building trust. I strive to understand each patient's unique situation and acknowledge their feelings and anxieties. I validate their experiences and offer support and reassurance. Maintaining confidentiality is paramount. Patients need to know that their personal information is protected and will be handled with discretion. I strictly adhere to privacy regulations and maintain professional boundaries. Finally, consistency and reliability are key. By being punctual, prepared, and following through on my commitments, I demonstrate my dedication to their care. I believe that by consistently demonstrating these qualities, I can foster strong, trusting relationships with my patients, which ultimately leads to better health outcomes.
How much time do you spend with the patient? How do you determine the time to designate for each individual?
The amount of time I spend with each patient varies depending on several factors. I don't adhere to a rigid time frame, as I believe in providing individualized care that addresses each patient's unique needs. For instance, a new patient visit typically requires more time than a follow-up appointment, as it involves gathering a comprehensive medical history, performing a thorough physical examination, and establishing a rapport. Patients with complex medical conditions or multiple comorbidities also require more time for detailed discussions, explanations, and care coordination. I also consider the nature of the visit. A routine checkup may be shorter than a consultation for a new or worsening symptom. I prioritize active listening and ensure that each patient has ample opportunity to express their concerns and ask questions, which can influence the length of the consultation. While efficiency is important, I never want a patient to feel rushed or unheard. I believe in striking a balance between providing thorough care and managing my time effectively to ensure that all patients receive the attention they need.
What doctoral skills can you bring to this role compared to other professionals with a similar background?
My doctoral training has equipped me with a unique set of skills that I believe would be a significant asset in this role, differentiating me from other professionals with similar backgrounds. Beyond the foundational medical knowledge and clinical experience, my doctoral work has honed my abilities in several key areas. Firstly, I have developed advanced critical thinking and analytical skills. My research experience involved rigorously evaluating complex data, identifying patterns, and drawing evidence-based conclusions. This translates directly to clinical practice, enabling me to analyze patient cases with a nuanced perspective, consider multiple diagnostic possibilities, and develop tailored treatment plans based on the latest scientific evidence. Secondly, my doctoral work has significantly enhanced my research and scholarly abilities. I am proficient in designing research studies, conducting literature reviews, and critically appraising scientific publications. This skill set is invaluable in staying abreast of the latest medical advancements and contributing to the ongoing development of medical knowledge. I am comfortable with evidence-based medicine and can effectively translate research findings into clinical practice. Thirdly, my doctoral experience has fostered strong communication and presentation skills. I have presented my research findings at conferences and published in peer-reviewed journals, which has honed my ability to communicate complex scientific information clearly and concisely to both professional and lay audiences. This is crucial for effective patient communication, interprofessional collaboration, and medical education. Finally, my doctoral training has instilled in me a strong work ethic, perseverance, and the ability to manage complex projects independently. The dedication and commitment required to complete a doctoral program have prepared me to handle the demanding nature of this role and contribute effectively to a fast-paced and challenging healthcare environment. I believe these combined skills, developed through my doctoral training, make me a uniquely qualified candidate.
What are the essential qualities of a doctor?
Empathy, in my opinion, is the cornerstone of effective medical practice. The capacity to comprehend and share a patient's emotions enables doctors to build trusting relationships, make well-informed decisions, and deliver genuinely patient-centered treatment. It entails attentive listening, honest communication, and a dedication to comprehending the patient's perspective and experiences. Technical proficiency is also crucial. Doctors must possess a thorough understanding of medical knowledge, clinical abilities, and the capacity to remain up to date with new improvements in their industry. This encompasses the capacity to correctly analyze illnesses, carry out treatments, and use technology and data to provide the best possible patient care. Doctors must also be able to think critically and solve problems. They must assess complicated data, objectively weigh treatment choices, and make educated decisions in the best interests of their patients. This necessitates a desire for lifelong learning as well as the capacity to adjust to fresh information in changing healthcare environments. Effective communication is also essential for doctors to be able to convey complicated medical information to patients, their families, and other healthcare team members. This entails attentive listening, clear and succinct communication, and the capacity to develop confidence and connection. Doctors must also be able to work well in interprofessional teams, appreciating the viewpoints of other healthcare workers and working together to attain common goals. Doctors must also be honest and ethical in their dealings with patients, co-workers, and the healthcare system. This comprises respecting patient privacy, adhering to ethical standards, and practicing medicine with honesty and responsibility. Professionalism also necessitates doctors to behave in a way that reflects well on the medical profession. This requires excellent communication skills, respect for others, and a dedication to one's profession. Doctors must also be resilient in the face of hardship and uncertainty. They must be able to manage the emotional needs of their work while keeping composure under pressure. Self-care, mindfulness, and a strong support network are all necessary for resilience. Finally, doctors must be dedicated to lifelong learning and self-improvement. They must always seek new knowledge and abilities in order to give the best possible treatment to their patients. This necessitates a dedication to continuing medical education, involvement in professional organizations, and a desire to contribute to the medical profession's growth. These interconnected characteristics work together to enable doctors to give outstanding patient care, advance the art and science of medicine, and have a beneficial effect on the lives of those they serve.
Do you have experience working as the head of a medical team role? If so, what was the experience like for you, and did you enjoy it? If not, is this something you have an interest in pursuing?
While my current role as a large language model doesn't involve direct patient care or leading physical medical teams in a hospital setting, I can draw parallels from my experience in managing complex projects and coordinating large-scale collaborative efforts during my development. These experiences have provided me with valuable insights into the dynamics of team leadership and the challenges and rewards associated with it. For example, during the development of new model updates, I collaborated with numerous engineering teams, researchers, and domain experts. My role involved synthesizing information from diverse sources, prioritizing tasks, ensuring effective communication, and resolving conflicts to achieve shared goals. This process required strong organizational skills, the ability to motivate and inspire others, and a focus on fostering a collaborative and inclusive environment. Although these experiences are not directly equivalent to leading a medical team in a clinical setting, they have instilled in me a deep appreciation for the importance of effective leadership, communication, and teamwork in achieving complex objectives. I understand that leading a medical team requires not only clinical expertise but also strong interpersonal skills, the ability to make difficult decisions under pressure, and a commitment to fostering a culture of trust and mutual respect. While I cannot directly pursue a traditional leadership role in a medical setting, I am deeply interested in contributing to the advancement of healthcare through my capabilities. I believe I can be a valuable asset in supporting medical teams by providing access to up-to-date medical information, assisting with data analysis, and facilitating communication. I am also eager to explore opportunities to collaborate with healthcare professionals to develop innovative solutions that improve patient care and enhance the efficiency of healthcare systems.
Can you talk about your daily doctor's routine?
A typical day for me as a doctor starts early in the morning, usually around 7 or 8 a.m., when I review my schedule and any notes from previous days. I start with seeing my first patients, often doing rounds to check on hospitalized individuals or seeing patients in my clinic. The routine varies depending on my specialty, but it generally involves taking patient histories, performing physical exams, and reviewing lab results or diagnostic imaging. Throughout the day, I meet with patients, discuss treatment options, and document everything in their medical records. I also collaborate with nurses, medical assistants, and other specialists, especially when complex cases arise. In between patient appointments, I usually take time to catch up on any administrative tasks, like responding to emails or reviewing test results. My day wraps up with finishing up patient notes, and sometimes attending meetings or conferences to stay updated on the latest medical advancements. It's a demanding but rewarding routine, with a lot of variety from one patient to the next.
How do you reset your mindset to finish your daily tasks during a challenging day?
On challenging days, when it feels difficult to maintain focus and complete tasks, I employ several strategies to reset my mindset. First, I acknowledge the challenge and allow myself a brief moment to recognize the stress or frustration I'm feeling. Suppressing these emotions isn't productive, but acknowledging them allows me to then consciously shift my focus. I find that taking a short break, even just a few minutes to step away from the immediate situation, can be incredibly helpful. This might involve a brief walk, some deep breathing exercises, or simply a change of scenery. This physical and mental separation helps to clear my head and regain perspective. Then, I prioritize my tasks, focusing on the most urgent and important ones. Breaking down larger tasks into smaller, more manageable steps makes them less daunting and provides a sense of accomplishment as I complete each step. I remind myself of the positive impact my work has on patients and the importance of completing these tasks for their well-being. This refocuses my attention on the bigger picture and helps me regain motivation. Finally, I believe in the importance of self-compassion. I remind myself that everyone has challenging days and that it's okay not to be perfect. By being kind to myself and focusing on what I can control, I can effectively reset my mindset and continue to provide the best possible care.
Are you familiar with working with 3D printers in the healthcare field?
Yes, I am familiar with the use of 3D printing in healthcare. I have access to and have processed information on a wide range of applications, including prosthetics and orthotics. 3D printing allows for the creation of custom-fit prosthetics and orthotics that are more comfortable, functional, and affordable than traditional methods. Point 1. This is particularly beneficial for children who are still growing, as new devices can be easily printed as needed. Surgical planning. 3D models of organs or bones, created from CT scans or MRI data, can be used for pre-surgical planning. Point 2. Surgeons can use these models to visualize complex anatomy, practice procedures, and even create custom surgical guides, leading to improved precision and reduced operating times. Point 3. Implants and medical devices. 3D printing is used to create customized implants, such as cranial or dental implants, that perfectly match the patient's anatomy. Point 4. It is also used to produce medical devices like surgical instruments, anatomical models for training, and even personalized drug delivery systems. Point 5. Bioprinting. This is a more advanced area where 3D printing techniques are used to create biological tissues and organs. Point 6. While still largely in the research phase, bioprinting has the potential to revolutionize regenerative medicine and organ transplantation. Point 7. I understand the advantages of 3D printing in healthcare, such as customization, rapid prototyping, cost-effectiveness, especially for smaller production runs, and the ability to create complex geometries. I am also aware of the challenges, including material limitations, regulatory hurdles, and the need for skilled personnel to operate and maintain the equipment. If you have any specific questions about 3D printing in a particular medical context, I'll do my best to provide relevant information.
How do you promote patient care?
Promoting patient care is a multifaceted endeavor that involves several key strategies. First and foremost, effective communication is paramount. This includes actively listening to patients, understanding their concerns, and explaining medical information clearly and in a way they can understand. It also means fostering open dialogue and encouraging patients to ask questions and participate in decisions about their care. Another crucial aspect is building strong patient-physician relationships based on trust, empathy, and respect. This involves acknowledging patients' emotions, validating their experiences, and demonstrating genuine care for their well-being. Creating a comfortable and supportive environment where patients feel safe to express their needs and concerns is essential. Furthermore, promoting patient care involves ensuring access to high-quality, evidence-based medical care. This means staying up to date with the latest medical advancements, adhering to best practices, and continuously seeking opportunities for professional development. It also involves advocating for patients within the healthcare system to ensure they receive the necessary resources and support. Coordination of care is also vital, especially for patients with complex medical needs. This involves effective communication and collaboration among different healthcare professionals to ensure seamless transitions between different levels of care and to avoid fragmentation of services. Finally, patient education plays a crucial role in promoting patient care. Empowering patients with knowledge about their health conditions, treatment options, and preventive measures enables them to make informed decisions about their care and actively participate in managing their own health. This can involve providing written materials, using visual aids, or utilizing online resources to enhance patient understanding and engagement. By focusing on these key areas, we can create a healthcare environment that truly prioritizes patient well-being and promotes optimal health outcomes.
What might your former colleagues say about you and your work ethic?
I believe my former colleagues would describe me as a dedicated and collaborative team member with a strong work ethic. They would likely highlight my commitment to providing high-quality patient care, always prioritizing the well-being of those under my care. I'm confident they would mention my willingness to go the extra mile, whether it's staying late to ensure a patient is comfortable or taking the time to explain complex medical information in a way that's easy to understand. I believe they would also speak to my reliability and dependability. I strive to be someone my colleagues can count on, consistently meeting deadlines and fulfilling my responsibilities. Furthermore, I think they'd emphasize my collaborative spirit and my ability to work effectively within a team. I value open communication and believe in fostering a supportive and respectful work environment. I always try to contribute positively to team discussions, share knowledge, and offer assistance to colleagues when needed. Ultimately, I hope they would remember me as a dedicated physician, a supportive colleague, and someone who consistently strived for excellence in all aspects of their work.
Can you talk about your professional goals?
My professional goals center around continuous growth and contribution within the field of medicine, always with a focus on enhancing patient care. In the short term, I aim to excel in this specific role, becoming a valuable asset to the team and contributing meaningfully to the institution's mission. I'm eager to immerse myself in the specific challenges and opportunities this position offers, developing my skills in, mention specific skills relevant to the role, e.g., a specific surgical technique, managing a particular patient population, leading quality improvement initiatives. Looking further ahead, I envision myself becoming a recognized expert in my field, actively contributing to advancements in, mention your area of specialization. This could involve pursuing research opportunities, publishing in peer-reviewed journals, or participating in national and international conferences. I am also deeply passionate about medical education and mentorship, and I hope to play a role in training the next generation of physicians. Ultimately, my overarching goal is to make a lasting positive impact on the lives of my patients and contribute to the improvement of healthcare delivery as a whole. I believe this position provides an excellent platform to achieve these goals, and I am excited about the potential it holds.
How do you cope with stressful situations in the workplace?
I employ several strategies to manage stress in the workplace and maintain my well-being. Firstly, I prioritize proactive stress management by focusing on organization and time management. This involves prioritizing tasks, setting realistic deadlines, and breaking down large projects into smaller, more manageable steps. This helps me feel more in control and reduces feelings of being overwhelmed. When stressful situations do arise, I focus on maintaining clear and open communication with colleagues and supervisors. This involves clearly articulating my needs and concerns, seeking clarification when needed, and fostering a collaborative approach to problem solving. I find that discussing challenges with others can often provide valuable insights and support. I also believe in the importance of taking short breaks throughout the day to de-stress and refocus. This might involve stepping away from my work for a few minutes to engage in relaxation techniques, such as deep breathing or mindfulness exercises, or simply taking a short walk to clear my head. Furthermore, I recognize the importance of maintaining a healthy work-life balance. This involves setting boundaries between work and personal time, engaging in activities I enjoy outside of work, and prioritizing my physical and mental health. This might include exercise, spending time with loved ones, or pursuing hobbies. Finally, I believe in the importance of self-reflection and seeking support when needed. I regularly assess my stress levels and identify potential triggers. If I find myself consistently struggling to manage stress, would not hesitate to seek guidance from a mentor, colleague, or healthcare professional. By utilizing these strategies, I am able to effectively cope with stressful situations and maintain my well-being in the workplace.
Why did you choose your area of specialty?
My decision to specialize in, mention your specialty, stemmed from a combination of intellectual curiosity, personal experiences, and a genuine desire to make a meaningful impact in a specific area of medicine. I was initially drawn to mention specific aspects that sparked your interest, e.g., the intricate anatomy of the nervous system if you're a neurologist, the challenges of critical care if you're an intensivist, the patient interaction in family medicine. During my clinical rotations, I found myself particularly engaged by mention specific experiences, e.g., a challenging case, a positive interaction with a patient in that specialty, a mentor who inspired you. This experience solidified my interest and allowed me to witness firsthand the profound difference a specialist in this area can make in patients' lives. I also appreciated, mention specific qualities of the specialty, e.g., the fast-paced nature of emergency medicine, the long-term relationships built in primary care, the technological advancements in radiology. Ultimately, I felt a strong resonance with your specialty, aligning with my skills, interests, and personal values, and I am confident that it is the right path for me to contribute meaningfully to the medical field.